that need extra support or additional services in order to achieve their maximum potential in life. That can be briefly defined.
Okay, well, how do those challenges manifest? Are these just physical challenges, mental, neurological? Or that's the next step now for our understanding.
Well, it manifests in different categories. It can be medical and physical, under which you have issues like cerebral palsy, you have issues like chronic illnesses, even cancer, seizure disorders, Sickle-Cell disease. It can be behavioral and developmental. It can manifest as that, where you talk about autism, you talk about attention deficit hyperactivity disorder, and some children who may even have some syndromic manifestations. Then we have learning issues. Some children may have issues with reading, issues with writing, or even coordinating motor activities. So broadly categorized, you can group them into those categories.
I'm wondering what degree of disability in this, among those who fall within these general terms, what would be the degree of disability for a child to be considered as a child of special need?
Well, there's a variation in degree. That's why it's a spectrum, from the mild to the severe form. So any disability that will impede you achieving your maximum potential is a need, because you need extra support. The only thing is that we miss a lot of them because we assume that the less severe form or the mild form is not a child with special need. But looking clearly and further into the life of the child, you notice that the child needs some extra support, so it's a child with need.
Okay, I'm still with you, Dr. Mbanefo. Our focus this morning is on cerebral palsy and autism. But for the lay person, you hear and read about all forms of needs that will arise for some kinds of children. You hear of Down syndrome, for instance. You hear of dyslexia, for instance. You talked about attention deficit. What are the differences? Down syndrome and autism, and cerebral palsy, dyslexia, and a number of its other names.
Well, in diagnosis, they have different ways of making diagnosis. We have charts, we have tools in which we use to clarify. Some are chromosomal abnormality, like Downs, as you said. You can easily make diagnosis. If you have a karyotyping, you can karyotype the child and you make a definite diagnosis of Downs. Unlike behavioral disorders like the autism, it moves from mild to severe. So you need a chart, a tool, in order to categorize the child. But the most important thing is for early detection. That's the most important thing.
Okay, let's go down to cerebral palsy and autism. Can you break it down for us?
Well, cerebral palsy is a motor disorder. It's a chronic motor disorder. And it arises because there's an injury to the brain that is yet to be matured. That's the immature brain. You understand? Simply put, is the inability to attain some motor functions of the child, because maybe during pregnancy, during birth, or after birth, there has been some injury to the brain, making the child not able to achieve the neuronal functions or the brain functions which the child is supposed to achieve.
Dr. Mbanefo, thanks a lot. Let's bring in Lola Aneke. We've used some fairly technical terms, and we need our viewers to also understand. I mean, while we're in the studios, and indeed a number of our viewers will know what motor skills are, I'm sure they have some average persons will be wondering. A child that is just born, you expect that child to be driving a motor car. So what are motor skills, and how does cerebral palsy affect motor skills?
Motor skills, simply in layman's terms, is movement. So movement is motor is, and there are two major kinds of movements. We have the large motor skills, large movement skills, and then we have the fine motor. So when we talk about the fine motor, the small movement like hand movement of your hand, fingers, just little movement. Of the
blinking of your eyes.
Those little movements. But the gross movement are the large motor, running, lifting up your hands, working, and all of that are the large motor. And because cerebral palsy affects movements, it exhibits itself in different ways with different individuals. So some individuals affect the whole motor movement, some of them to be their fine motor movement. Sometimes you see some children with cerebral palsy who cannot hold a pencil. Sometimes their hands is just this way. Sometimes their leg is just a particular way. They're tiptoeing, they're not able to walk because of what the damage in the brain has affected that part that controls the part of the movement.
Is there a linkage, part of what you are saying now, is there a linkage between the sickle cell disorder and cerebral palsy? Because sometimes you find some children, depending on how they've been hit, they manifest some of these motor skill deficiencies.
There's no linkage between motor skills deficit and cerebral. Sickle cell. Sickle cell has to do with the cells being affected. So there's a deformity and it's affected, and it's not all. So for sickle cell, individual living with sickle cell, I'm very mindful of the words I use because you have to use the person first language. For an individual living with sickle cell, it's because I'm close to someone who has sickle cell, so I can see it. I know it firsthand. It's the way cerebral palsy exhibits itself. It's something that is there. So a child is born with cerebral palsy. It's not progressive, but if whatever aspect is being affected remains like that. So if you see the child in January, in December 2019, 2020, the child is still the same way. For a person with sickle cell, whenever there's a what they call it, whenever there's
a crisis
is when you see that person. So if he's not able to move at a particular time, is where that's area that's affected at that point in time. So the major difference is that the person with cerebral palsy lives with cerebral palsy every day. Where a person with sickle cell only has those
occasional crisis.
Exactly. So that's the difference.
I don't know, Lola. In the course of interacting with children with special needs, can you give us what your typical day is like in terms of, the symptoms, the manifestations, and all that?
Okay, so my certification covers for children with 13 different disabilities, which doctor has already mentioned a few of them. And if I were, because we practice a one-on-one service delivery with them. So if I were to talk about probably 2 or 3 of them at the same time, you need to first understand what is going on with that child, because what works for child A might not work with child B. Even a child living with autism will not exhibit the same way as child B or C would exhibit it. So the first thing you want to do is you need to understand what the child is and what works for that child in terms of the need of the child. It could be a social interaction deficit. It could be speech impairment, in the sense that some of them are verbal and non-verbal. Some of them they just use words. Some of them don't use words at all. Then it could also be an area of social interaction. It could be an issue of sensory integration disorder. So knowing that, it could also be a child who has dyslexia and a challenge reading. So you need to first understand what's going on with that child and then plan your day with the child individually.
At what age do you detect, maybe the doctor should have answered it, but at what age do you detect that a child, will probably have CP or ASD?
Okay, so for CP, it's quite easy.
CP, cerebral palsy.
Cerebral palsy.
CP stands commonly for Commissioner of Police.
For cerebral palsy, it's always very easy. It's more easier to identify than a child with autism, which we're going to get to that now. For cerebral palsy, the issue of neck control, or these days, some kids actually roll over at 2 or 3 weeks. So when you have a child who is not, like we say, fine and gross motor, the child is not able to control the neck, which you see between a month, am I correct?
3 months.
3 months, 3 months. And then the roll over also. So when you're not seeing those things, are a red flag for you to know that there's something going on. Sometimes as little as even when they're born, they're not able to latch on to suck the mother's breast. They're not able to control the movement. There's a movement going on. It's easier to see all of that. And then those are red flags. And of course, professionals will be able to come in and provide intervention needed for the child, because early intervention, we say, is very key. But for autism, the easiest way to know, some people, different countries have different age, at what age are able to diagnose it. But I know that in the US, by 18 months, to be able to diagnose it. But before then, you can see, diagnosis means you place a name on it, but you can see the symptoms and signs when they're still very young. So eye contact for babies, a child with between a month, am I correct, doctor, can actually look at you. You can actually know that the child knows who is maybe the mother or the father. But for children will not give eye contact. Some of them are beginning to have I don't know what that is called, the seizure. That's minor, where they just begin to jerk, and people are like, oh, this child is just being very playful. Some of those things, what you see at early stage, but diagnosis takes place from 18 months.
Okay, thanks a lot. That jerky you were talking about is not. Let some of our viewers not mistake it for hiccup.
No.
You know, when the baby has a hiccup, you know, when we were much younger, they said look for a white thread and put on the baby's head. Instead of you to give the baby water, or give the baby breast milk, say put the thread there.
It did work.
After some time, it will work, but that is not the correct. Don't go and put a thread on your baby's head and say child is hicking up.
Professional help is the best.
Okay, all right. Yes. Ijoma is here with us in the studios, but we have another guest from our Lagos Network Center. Let's just introduce her in the meantime. Noye Nweke, who is founder Cerebral Palsy Center in Lagos. Noye, pleasure to have you with us on the program this morning.
Pleasure to be here. Good morning, Nigeria.
Okay, let's just kick off with you, because we'll come back to Ijoma later, who is a physiotherapist, and that will tell us about how to manage some of the conditions that we're talking about. Cerebral Palsy Center, what are the issues that you deal with, and what do you find in terms of running your center?
Okay, running Cerebral Palsy Center, what do we deal with? We deal with children with cerebral palsy, and we provide care and therapy for them. Incidentally, all the children in the center are on the severe spectrum, like the doctor just said. Most of these issues of special needs are on spectrum. So the children on Cerebral Palsy Center are on the broad spectrum, on the severe spectrum, because that's where my daughter happens to be. My daughter has cerebral palsy. And what we do, we provide a succor. We provide succor for the parents, because when you have a child like my daughter, you find out that the child may not be able to attend the regular schools. And the mother wants to wake up and still have a near normal life. By that I mean she still wants to go and sell in the market, or she still wants to go to work. So such children oftentimes are not accepted in the regular school. And even when they're accepted, they wouldn't know what to do with them. So we are more centered on provision of therapies for the children, because for cerebral palsy, it's an everyday affair. If you don't do the therapies, the children will begin to develop contractures. They will develop a lot of issues which you have to deal with. So basically, that's what we do in Cerebral Palsy Center.
You just talked about the fact that you have a daughter. How old is she, and at what age did you find out that she might be living with cerebral palsy?
Aneke said, cerebral palsy oftentimes is very easy to know. Sometimes at the point of birth, the doctor may suspect that something, to a large extent, that the child will have cerebral palsy. But for me, because my daughter, I'm a first-time mom, and my daughter is adopted, so I didn't have any yardstick. So by 3-4 months, I noticed that something wasn't quite right with her, because she was jerking. She had what I now know is infantile spasm. She didn't have the neck control at the point she was supposed to have that. She couldn't even close. She wasn't sleeping very well. So the issues were there. For cerebral palsy, one of the first things the mother will notice is that the child will not meet her developmental milestones. She's not going to sit when she's supposed to. She'll not even go to hold up her neck when she's supposed to hold up her neck. If the child is on the severe spectrum, or if the child has comorbidity, maybe having seizures, she will notice that the child will be having seizures. But for an uninformed person like I didn't realize that was seizures. I thought my child was just being a very strong girl. So these were things I saw. And then by the 5th month, I was almost certain that something was wrong with my baby. So I went to the hospital, and the doctor just asked me a simple question: what happened at birth? And I remember he said this child was resuscitated. So knowing what I know now, that's why I said, if at the point of birth, a lot of things, the doctors we know, we place a red flag on a particular child. For instance, if the child came out severely asphyxiated, that is, if the child did not cry for a long time, even for, I think they say after 4 minutes or thereabouts, if the child didn't cry, they begin to suspect. Even if they go home, they're supposed to tell the mom to please come back, early, so that we can check on this child. Then maybe if the child had jaundice that was not properly managed, maybe they didn't report on time, maybe before they came to report the child had done this. A lot of things has happened. The child has had a brain damage, which is from Connecticut. So the child will have cerebral palsy. So from that 3, 4, 5 months, they will know. So it's easy to know for cerebral palsy.
I don't know, Kinsley. I just wanted, you talk about severe spectrum. Give us a sense of understanding of what that is.
They have what they call levels 1, 2, 3, and 4 on the motor scale. That's, they've classified. That's what they call gross motor function classification system. What that means that at a certain age, a child is supposed to be doing certain motor things. For instance, at age, maybe I think it's 3, 4, 5 months, 6 months, a child is supposed to sit up. At maybe 7, 8 months or thereabout, the child is supposed to walk, crawl, and that kind of a thing. Then if a child, I think they use 12 years to do that classification. So if a child at a certain age is not doing certain things supposed to be doing, for instance, a child on the severe spectrum of CP may never achieve any, I'm using the word may, achieve any of the motor skills. That is, she may never sit unsupported. That is, he will always, you have to strap him or her when he's sitting, may never crawl, may never have use of hand, may never walk. Even using a walker, he will always be supported. On the mild spectrum, we see a lot of them around. There are lawyers, there are accountants, there are everything, particularly if they don't have comorbidity, as if they don't have seizures or other things coming with it. So these are on the mild spectrum, but on this moderate spectrum, they come in between. Some of them are able to use their walker. We have few of them around. They're depending again on who is behind you. By that I mean, if you have a lot of support, you find out that you achieve much more than somebody who didn't have support. By that I mean, who are your parents? Did they know what was wrong with you ab initio so that they will be able to give you the intervention you need? Was there facilities available to help you to achieve those things? So these are the things that play out in managing children, not just cerebral palsy, but other children with special needs.
Okay, Noya, thanks a lot. I mean, temptation is strong to stay with you because you mentioned something now that some of them are lawyers, accountants, professionals. Is it possible that some persons might be living with cerebral palsy without even recognizing that they have either the mild form or something of that nature?
I will tell you something. I remember meeting a woman. She said it was when she was, I think after the war, she was born short. I think 67, that was when the war started or thereabouts. So obviously she had the mild cerebral palsy. It was after the war when they went to England. Her father took her to England, that they found that, from diagnosis, they now say she has cerebral palsy. So you might have it because you don't know what it's called. And because it's mildly affected, maybe you didn't walk when you are supposed to walk, and then now you are walking with a gait. That's what I mean by gait, you are walking. We see them around, we laugh at them in schools. They're walking with, maybe their hands, placed somehow, and their feet somehow. So they're there. It didn't affect their intellect. So they're able to function with little or no support, like, the regular people. The ones on the severe spectrum, they need support all their lives, particularly if they have comorbidity. Right.
All right, let's get back to Abuja, and I want Dr. Mbanefo to, we've talked about several manifestations, symptoms, which seem to relate with autism. I don't know how to put it. Can a cerebral palsy or someone living with cerebral palsy be autistic as well?
Yes, it's possible because autism is a spectrum. It has not precluded the patient from having other illnesses other human beings can have. If it may be autistic, but during the birth, you had some form of asphyxia, inability to cry after birth, because if the child is not able to cry, the tendency for the decreased oxygen supply to the brain is increased, and some of the functions of that particular part of the brain is already affected. So you may develop cerebral palsy on an existing autism in a child. So it can be a comorbidity. And when you have a comorbidity in such a patient, the manifestation is severe. So the child will be needing a lot of support and assistance in order to move on with the day's activities.
Okay, Dr. Manefo, thanks a lot. Ijoma, you've sat down soaking all of this up. Let's, and of course, you are a physiotherapist with Alliance Hospital here in Abuja. Let us understand a few of the things that have been talked about. They say, okay, a baby is born and the baby doesn't cry. We know that in those days, if the baby doesn't cry, the grandma will, at birth, spank the baby, or sometimes, but these are practices that obviously perhaps could also be harmful. They could also turn the baby upside down, and the baby breathes or then begins to cry or pinch the baby or otherwise. And then in Lagos, Noye also talked about if a baby is unable to sit at the time the baby should sit. We have seen that there is practice, babysitting. When you practice babysitting at a certain age, the baby is propped up with a throw pillow, and then of course you see the neck is under oscillating like this, and then after a while the baby begins to get strong. So how explain all of this? Is it the failure to do that thing at the right time? The baby wasn't beaten or what?
No. I don't think it's about the baby was not beaten or the baby was not forced to cry, because the injury is within the baby. And if it's not properly managed, if it's something that happened maybe at that point of birth and it was not properly managed, then you find out that it's affected the brain. And because it's affected the brain, most times it takes time. The baby now has what we call delayed developmental milestones. By that, by the time you expect like 3 months, the baby should be able to have neck control. But you find out that this baby has no neck control. Well, sometimes parents might say, she will do. Then you also expect that at 4 months, 5 months, this baby should be able to sit. At least sit a bit. Then you can laugh and say, yeah, you can sit. But this baby doesn't have this. Even with minimal support, it cannot. 6 months, it cannot sit. At the time you expect this baby to be able to stand up and hold something in the house. For 7 months, 8 months, this baby basically cannot stand even holding something. And in my 1 year, you expect that this baby should be able to walk. By the time he's having her birthday or his birthday, you threaten the baby that if you don't walk, we will not celebrate birthday for you. But then you find out that at the 1 year birthday, this baby is yet not walking and not maybe making attempts to walk, not even holding something to walk. Then every parent should have that red flag that something is wrong. And basically, early attention is always very, very important. So that by the time they take the baby to hospital and is diagnosed, this baby is referred for physiotherapy. And the physiotherapists, they are experts. So we have this.
Okay, you know what, Ijoma, we're going to have to pause you. Our engineers are indicating that there's an issue with your microphone, and I'm sure they will sort that out. Now, if we are through to Kano, we would like to introduce our guests in Kano. You can see her on the right side of your screen, Aisha Bosse Funsho, who is also the founder of KF Place Curriculum Rehabilitation and Reintegration Center for children with special needs. Aisha Funsho, pleasure to have you with us on the program this morning.
Thank you for having me. Good morning, Nigerians.
All right, now give us your experience with running your center. What kind of patrons do you have?
It's just so amazing, really, to say I'll find myself in this field of the special need. Unfortunately, there was a fire incident that affected my daughter. In her own case, it's a traumatic brain injury. She had inhalation injury. That should be about 2011. And I have actually had to manage her condition, from a normal child to suddenly becoming abnormal. I don't know. You understand what that means? So it's been the hell of a work for me, for the father, for the sister, the siblings. They are honestly with the best. I think when they cooperate with you to take care of the special need in the house, it's very, very important. And so after a while, I just thought, well, Kano, for what it is, it's not like you have in Lagos and Abuja that you have special centers all over the places. we don't really have that much in Kano. So I just came up with the idea of, why don't I have a center to take care of my daughter? And so the ideas came up. Just 2 years ago, we started Care Place. I named it after her. And since she is about 13 years old now, she was 4 years old when we had a fire incident. And it's been good. I have children, parents bringing in their children to the center, parents encouraging and supporting. In fact, it's been very amazing. It's been a fulfilling journey for me that I never thought I was actually going to be in it. And caring for these children, like I always tell parents, it's key. Early intervention is key, and then you show them so much love. That's very important. So you see their improvements will surprise you with care and love, attention particularly. It's not really easy, honestly. If you ask me, I know what I've been through. I can just say it's been God, really. But we thank God, so far so good. And the center, I have different disabilities, like I said. I just opened it because I just needed to do something for my daughter. So I have people bringing all kinds of cases. I have a child with a clock-like implant, hearing impairment. In fact, most of the kids I have are CP, Cerebral Palsy, just like we were discussing this morning. And I also have Down syndrome, and I have our own case, like I said, traumatic brain injury, because the brain was really destroyed there. But even though it was a hopeless case then, you find out that she's doing exploits now. She speaks, she hears, she does every other thing except walking. So she's still incapacitated on the wheelchair, which we are hopeful, honestly, that she will definitely move one day. And that's why in the center, I focus mainly on therapies. We have physiotherapists coming 3 times weekly. In fact, from next year, by the grace of God, we're going to have a physio every day, because I believe with that, it is going to be more effective functioning of the system for them. So we have also therapies like the equine therapies for the kids, which they always look forward to. That we do just once a week. And what else do we do? So curriculum, like I said, is a curriculum set also. We also teach, so that's basic things of life, basic knowledge that can make them independent, that can make them have an appreciable life. We do at the center.
Okay, Aisha Funshaw, thanks a lot for your explanation and the personal experience that you have shared with our viewers this morning. Well, I didn't quite get the early part of your contribution. Now, you indicated that your child suffered some traumatic injury. How old was she when she had that injury?
She was 4 years old.
All right, thank you very much. We'll return to you. I just wanted to get the medical perspective to this. Now, because we'll be talking about child at birth not crying, child at birth, suffering from asphyxiation, and so on and so forth. Dr. Mbanefo, tell us something. Can cerebral palsy be the result, on the basis of the experience that Mrs. Funshaw has just indicated to us, occur when the child is no longer an infant? Infancy being from day 1 to 5 years.
No, infancy is actually the first 12 months of life. That's infancy. An infant is a child in the first 12 months of life. Because the cerebral palsy is with developing brain, not a matured brain, it's expected that by the age of 5, most of the brain tissue and neurons are fully developed. So after the full development of the brain, there is no longer cerebral palsy. That's one. 2, is a direct injury. It's not a progressive injury. It's one-off injury. However, the clinical manifestation can vary over the course of the whole illness. So cerebral palsy, the cause of the illness is different from a traumatic brain damage that occurred due to bronze injury and all those things. So it may be different. However, both are children with special need, and we need to take care of their daily needs.
Still on this, Claire, I'm tempted. That's the definition of infants that you just mentioned. It says 12 months or so?
Yes, first 12 months.
First 12 months. So after 12 months, what are you called?
You can be a toddler, you can be a preschool, you can be a school age adolescent.
So when you say infant mortality, what are you referring to?
Under 12. under 12 months.
On the 12
Is it
month.
not under 5?
Under 5.
No, under 5 mortality is
Eight.
different. Infant
Okay.
mortality is different.
Okay.
Neonatal
Okay.
mortality is different.
Different. Oh, okay. All right, that's fine. But Claire, one point. One point. Do preterm children also run the risk of getting or suffering from cerebral palsy or autism? Preterm, in other words, what people generally would call premature. Because you hear of instances where the baby is born and is put in an incubator for several weeks. Do those children also run the risk of developing cerebral palsy or autism?
Definitely, for cerebral palsy, preterm babies have a higher risk of developing cerebral palsy because their brain tissue is not fully developed, and it depends on the degree of prematurity. Medically, we classify prematurity, late preterm, and maybe very severe preterm. But for a child who is born, a baby born with birth weight of less than 1,500 gram or 1.5 kilogram, there's increased risk of brain damage, increased risk of maybe the white part of the brain is not fully developed, or there may be bleeding into the brain. All those ones can lead to cerebral palsy later on.
All right, Casey, thank you for those questions. Let's get back to Lagos, where Nonye, of course, is a founder of a CP Center and has a daughter who is also living with this condition. Nonye, can you share with us the burden of managing a child with special needs, such as a child living with a CP? And was that the motivation for you?
Well, cerebral palsy is said to be the most expensive disorder to manage all over the world. When a child, has cerebral palsy, it puts you on the pathway of poverty. Now, here you have a child, you have to do everything. I mean, because I'm wearing the shoes of a mother with a child on the severe spectrum, and all the children I manage at CP Center are on the severe spectrum, I am more at home discussing on that spectrum, because oftentimes those are the ones that are left behind. Those are the ones that we don't see outside, and those are the ones that suffer most. Those are the ones that the parents go into depression, particularly the mothers. So, managing a child with CP, you have, for instance, you have a 13-year-old, the child is still on diapers. The cost of diaper, we can just imagine what it is. Then if the child has comorbidity, that is, as maybe the child has seizure disorders, then you have to buy the seizure medications. Most of the children, I have 3 children at the center who can't even feed by mouth. You had Aneke talk about, difficulty in swallowing. This is one of the hallmarks of children with cerebral palsy. You have to feed them specially. So you find out that for 3 children I have there, because I have the public supporting me, and I'm able to get them to have a tubes fixed in their stomach so they can live. The tube costs $200, and every 3 months you must change it. So imagine the yalata on the street who have a child like this. And then if you don't have a car, of course, you might say that is luxury. But then there is always this accusation that mothers abandon their children, that they don't bring out their children. You don't have the facility to bring out their child. I say that it's the society who pushes the children and the parents out. They don't want to see you. Even in churches, there are no ramps, there is nothing. You don't have the appropriate wheelchair. The chair my daughter sits on sells for over $3,000. Because I have the public supporting me. I have families, and my family is there that help me to buy the chair. We have only that one kind of chair in the center. It's people that put money together and we bought it. So it's difficult managing children like this, but I think this is where the public, everybody says government, but I sit aside and say no. There should be something like a private-public partnership. These children need to wake up every day and go somewhere so that their parents can, find something to do. We know that in a society like this, it's difficult for even, 2 parents supporting a home, much less a single family income just coming in. So you know that the mother too needs to go and work, or even need to be useful. So they need to have a place. The public, the private organizations, the corporate organizations, they need to support centers to build up places for these children, because when they go out, they improve. When you do therapy on them, they may never walk, they may never, like I said, they may never fly the aircraft, or that's what they say now, right? Good. But they can have a good quality of life. I always say, encourage people who visit the center, when you come in today, please look at the children, note their names. When you come back next year, ask after those children, and then ask me, why is this child still like this? You will see that the child is improving. But for that improvement, you need a lot of work. Physio or whichever therapy in the center, we've moved from physiotherapy to what is called advanced biomechanical rehabilitation therapy. This year, I brought in people from Belgium to come and train my staff on this therapy. That's what we do on the children. So you need a lot of, it's a lot. For instance, for me to be here, I have to wake up at 4 because I have to bathe the children. You have children that you have to do everything for. It's backbreaking. So the families need a lot of support. They don't need hand-downs. They need to have a place where they can have their children go so they can earn something to take care of the other children too as well. Thank you.
Thank you very much, Noye. Let's come back to Ijoma. We've been talking about management, which is physio. Give us your experience in handling persons or children with special needs.
Yeah, basically, as a physiotherapist, what you need to do is, one, trying to reduce pain. Because you find out that these children, they're not able to use their hands, they're not able to feed themselves, they're not able to walk, they're not able to stand. So their body, the muscles, the joints, there is a lot of disuse, and disuse causes pain. So basically, the number one thing is management of pain. And then you need to try to get functionality of these joints, these muscles. You try to move them, range of motion exercises to make sure that you keep them active. You make sure that you extend the muscles to get them to the full length. So that first of all, you are trying to avoid contractures that might set in if those things are not done. You are trying to reduce pain. You are trying to keep the muscle tone up. You are trying to make sure that these muscles are up and doing, such that as the baby is developing, and the repetition of these movements helps the brain to learn to do some of these things. So that is why the physio is very, very important.
How effective for children living with CP and autism, how effective is physio?
Physiotherapy is very effective, though it could be delayed. That could be delayed. You might expect that in 6 months, maybe with physiotherapy, this baby should be able to have neck control, this baby should be able to sit. But most times, what works for baby A may not work for baby B. Baby A might have mild injury to the brain. And so with that, this repetitive movement, the physiotherapy, with no time, little or no time, the baby begins to pick up. Another baby might have severe injury that you might do physiotherapy 1 year, 2 years, this baby still doesn't have neck control. So it's a lot of patience, it's a lot of, empathy on the part of the physiotherapist, on the part of the patient.
Would it require, is it a continuous session?
It is a continuous thing until the
That's
baby,
right. Is it
until
lifelong?
this baby begins to pick up. Until the brain understands that this and this are normal things that the body needs to do, and the brain tells the body to do it.
The brain now takes control.
The brain now takes control until you get this baby to the point that it can be independent a bit, and the quality of life is improved.
So adults don't suffer from, well, of course, we talked about...
injury to the base of the skull, like that baby they talked about. Injury to the base of the skull can also lead to a disorder or something that is close to cerebral palsy. So apparently that was why it was classified as cerebral palsy. Injury to the base of the skull, even in an adult, can cause an adult, a normal adult who normally wakes up, does everything, is independent, but because of that injury can wake up someday and is not able to carry his neck, is not able to move and all that.
So, but the human body is very complicated.
Yes, very complicated.
So, Lola?
So the base of the skull is very, very important. And injury to the base of the skull can lead to any motor disorder.
But is that the one that connects to the spinal cord and all of them?
Direct to the spinal cord, yeah. And the correct.
Well, Lola, tell us something. This time I want you to let's look at it from the social perspective. From your experience, what is the attitude, the social attitude to children with special needs in your jurisdiction? It would appear, attitudes may be changing here in our own environment, but some families that will hide, keep away those children, would sometimes believe that it is punishment, for some infidelity or indiscretion, or otherwise it's, people just through a spiritual attack and all that. And it's seen as a shame, to even have such a baby. So what are the differences in attitudes from where you practice?
Okay, I'll start with the family unit, the parent himself and the nuclear family itself, the people around the child in the home. There are several reasons. Well, the belief, like you say, you mentioned a lot of the things that people think could be an attack. It could be that is a curse. It could be that the child is a bad gift to them, So that is the way they perceive it that would not help them to also for the other societies to accept the child. So most times I've seen stories and I've seen cases where the parents feel that this child should be hidden. Sometimes it breaks the home. Like you see a united family, once a child is born with any kind of disability or specialness, they begin to point finger. Most times it's always the mother. Oh, if only you had done this while doing antenatal. If only you didn't smoke. If only you didn't do this. The blame is on the mother. So most time when there's a break in the union of the home, the mother tends to bear all of this. And of course, she doesn't want society to see her as funny. She doesn't want society to see her as a witch or whatever it is. They begin to hide the child. That's one. And I also say to parents, look, if you do not advocate for your child, if you do not speak up for your child, nobody will love your child more than you do. The moment you begin to bring the child out, the minute you just speak about what is going on with your child, and that takes a lot of knowledge about what is going on. Awareness and advocacy takes knowledge. Knowing, thankfully, Noye just said it this morning. Mr. Wake just said it this morning. You need to know. She's speaking from a knowledge perspective. Mm-hmm. And when you speak, society accepts your child. And then to the society, you hear people say, those kind of children. They will use words like abami, things that they're not human. But the truth is that the same way they were conceived, the same way they were birthed was the same way every other person was. It's just that, like I keep saying to people, we are different. Therefore, we celebrate uniqueness in everybody. We have seen, like Ms. Aneke just said, we've seen people that are living with CP, that are engineers, they're doctors, they're lawyers. And the truth is that there's something called neurodiversity in every field. Ability to understand that how people express and exhibit things in different ways, and we should celebrate them for who they are, find their strength and be able to harness that strength and make them the best they can be. So the idea of we looking down on them and say, oh, they cannot be, they're not normal, they're not like us, it should be discouraged. And the reason why people do that, when you do not understand what's going on, you begin to demystify, like, oh, you give it a kind of name that you don't understand. Once there's knowledge, once there's awareness, then the world will be a better place. The world, I mean, we are in this world, we have the black, the white, the short, the tall. Why don't we accept these individuals? Yes, people will stigmatize, but find a strength in them and you see that they'll go very far in life.
Okay, Lola, thank you. I'd like Dr. Mbanefo to clarify for us, because when we talk about injury to the brain, for children who are living with CP or autism at birth, what triggers the injury to the brain? Is it a habit of the mother, during pregnancy, or is it at birth in the process of, delivery, or what?
It spans all two. If a mother during pregnancy had some illnesses, febrile illnesses, it can move from the placenta to the child. The placenta supplies the child, and from there, because the blood-brain barrier is still permeable, the infection can move from the mother to the brain of the child and affect the child. That's while the child is still being carried in the womb. There are some infections, what we call intrauterine infections, a mother can have that can move from the placenta and affect the baby in utero. That's one of it. The second part is during delivery. It's like is an act. The baby passes through the birth canal. Along that pathway, there may be some injury. If the mother
assisted, if the delivery is assisted?
No, if it is SVD, that's spontaneous, through the vaginal delivery. Okay. Understand? Assisted, are you talking about maybe
yes,
cesarean section?
Even through the vagina, using forceps.
From the forceps, yes. All those can add to the trauma of delivery. Yeah. And trauma of delivery can lead to cerebral palsy because there may be injury to the brain.
What happens sometimes when they say there is it delayed labor or so, or prolonged labor? Yes.
Well, prolonged labor, there's a duration, first stage of labor, second stage of labor, and third stage of labor. There's a particular number of hours is expected to last. In some cases, it can be prolonged beyond 24 hours. And when it's prolonged, there are so many chances of infection because the birth canal is already open. People say, I've broken water. You always hear people say that.
Yes.
So there's tendency for infection to move from the outside world to the inside, which is supposed to be a sterile environment. So it will increase the chances of having infection. And when you have infection and you know the brain is still not developed, it can lead to even meningitis at birth and all those things. The child can have an injury. So it's not only traumatic injury, it can be infections and even metabolic injuries too. And sometimes if you deliver a baby who is not having enough glucose, because of decreased glucose supply to the brain, it can still affect the child and cause an injury, what we call hypoglycemia in medical parlance. But it's just like glucose is not supplied to the brain. So all those ones can cause injury to the brain while the child is still in the uterus, while the child is being delivered, or even after delivery. Because after delivery, we may have jaundice due to so many reasons.
Okay, Dr. Mbanefo, thank you. My question will go to, we've got quite a number of tweets, actually. I will be taking that in a short while. But Noye and Aisha Bose in Kano, this is my question to both of you. But first to Noye, you talk about special centers and you are a founder of one. Does it mean that we don't have, normal hospitals that can take care of children with these special needs, specifically CP and autism?
The funny thing is that cerebral palsy is not a sickness. The doctor will tell you that. It's a complex thing. It's not a sickness, so you don't need a hospital. But it's like, when you have your child maybe now they start as early as 1 year. They start to go to preschool. 1 year they go to primary school, secondary school, and all that. Now you have a child who is not able to go to school, or the regular school, let me put it that way. So you need a special place for this child. Like I said, depending on how severe the child is. A child on the mild spectrum, we go to regular school, can accommodate that. But if you have a child like, the children I have at the center, you need a place for that. You need a place where they can wake up and go to, so that their therapy will be done to them. They can be well taken care of. They can be better managed. And management entails therapy, care. You have to feed them specially. Some of them, you don't give them the regular food because you have to prepare the food regularly. 13 years ago when I had my daughter, I wanted a center where children with cerebral palsy are managed. In fact, back then, of course, 13 years ago, internet was not what it is today. So back then, information wasn't what it is today. So I decided there's a need to create awareness, to have a place. I personally experienced, I took my daughter to a daycare, and she was turned back. So that means I was stuck with my daughter. I couldn't do my work as I should. And I imagine that a lot of women were going through the same thing. I met them in the hospitals. So I decided to have a place for them. Now, if you call a physiotherapist to work with your child at home, which is what a lot of us do, the money, you don't even want to talk about it. It's too expensive. The ordinary man on the street cannot do that. Those are the children you see. Those are the ones you see their children very distorted, not looking well at all because they can't afford the private therapists. In the hospitals, let's not talk about that. What happens in the government hospital, because the crowd is so much, you don't get much of attention. So you need somewhere you can manage. It was in that anger, if you call it that way, that I started a free center. Because they were charging a lot of money. I decided, okay, I will go to the public and get money for them to have this place where nobody pays anything. The children can be brought there. And I employ people with the money people give us, and I pay them. And I'm able to manage the children. And I bet you, in 9 years, it will be 10 years next year. It's been wonderful because you see, when you look at the children, like I say, they're not flying, but you see you see the progress they have made. And then you see the families you have saved. Like Ms. Aneke said, when you have a child with disability, it breaks up families. But when you have a place where they can go, they are cancelled, they see their children making progress, the woman can have some respite, it helps the family, which eventually helps the society. So I didn't find a place for children with cerebral palsy 10 years ago. There are centers where they manage children with all disabilities. But like when you finish reading medicine, you go for specialization. Because when you have specialty, you are better focused. That is why each time I just talk about cerebral palsy. I'm better focused. I'm better to see those kind of things that help to improve their lives. What do I do to help them? But when you have all of them matched, which is good too, but I decided that I better just focus on that because it's a very, very huge, it's a very huge condition that requires a lot of attention. So that is why I'm focused on cerebral palsy. And I don't know as at now if there are other centers for cerebral palsy, but I know there are a lot of centers that manage children with all disabilities.
Okay, well, Noye, just before we cross over to Kano, I would like you to explain something. Do the children with special needs, that's in this particular case now, cerebral palsy, under your care, do they graduate or are they there for all times?
I will tell you, we've had children, 3 of them, that we have sent to regular schools. That is, they came in and we start working on them. Maybe after 2 or 3 years, they have made progress, they have achieved the use of functional use of hands to some extent. They are not walking, but the wheelchair sellers are there, so we buy the wheelchair. They were able to put them in school, so they've graduated. But they've just graduated, but they still come for therapies. Like a doctor will tell you, or the physiotherapist, you have to keep doing the therapy. So they have to make out time to come for their therapies. Some of them do come because of distance; they're not able to come, but they're encouraged to find places where they can go and do therapies. Now the children, like my daughter, may never graduate. I use the word with all due caution because I might be asked if I'm not a Christian. But I like to face reality. If at 13, my daughter has not, a child like her has not gained neck control, and we've been doing therapy since she was 7 months. She was diagnosed at 5 months. And for 7 months, since she was 7 months, we've been doing aggressive therapies. They know me at Luz, Ibobi, and all sorts. And at 13, she still can't even sit unsupported. It means that she may not graduate. For life, she's totally dependent. So a place needs to be created for people, not just for her, but not just her, but other people like her, where families will come and ensure that their children are well taken care of in a very beautiful environment. I've been to centers. If you go to Turkey, if you walk into their CP center, you want to have cerebral palsy. They have severe spectrum, children on severe spectrum, but it's a beautiful environment, which is what I'm trying to recreate here to some extent.
All right, Noye, thanks. Now, let's also go over to Aisha Funsho in Kano. Aisha Funsho, tell us what your experience has been with also managing children at your center. What is the graduation rate like? And then what is the patronage like? Is there awareness of the availability of a center where such children can be taken care of, or are they hidden or simply cast away?
Thank you very much. Actually, like I mentioned earlier, I did not foresee coming into this field. 10 years ago, somebody had told me I was going to have a special needs center. I would deny it. I had a normal child, a very normal child, very brilliant girl for that matter, until after the fire. And so, ever since we started the center, it's been encouraging. Of course, I started the awareness program too, sometimes early this year, until I had issues with the landlord and I had to relocate, but thank God that has been taken very good care of too. And like you said too, on centers, special centers, yes, there's need for it, because at the time I started, people still, hide their kids with special needs. And then when parents come to me and they see the way I talk freely about my daughter, her kids, and every other thing, I take my daughter out to shopping, I take her out to parties, I make people understand that it is not our fault, neither is it my fault. So there is no point hiding these children. And then the awareness we'll be trying to create to people is that you don't have to, the only thing you can do is just to help these kids. The only thing you can do is to improve and make them have an appreciable life. So people come and say, madam, is like, this is why God allowed this thing to happen to your child. Oh, this is your calling, see the way you're doing so effortlessly. And I have accepted my faith, and I personally, very passionate about things I do. I was into events, business before the fire. And of course, after the fire, every other thing just comatose, and life was not easy, like I mentioned earlier. But, after a while, understanding the fact that my once a very brilliant daughter could not do anything again. Of course, she was on Pampers for like 5 years, just like Noye mentioned in Lagos, it's quite really expensive when you take care of a child with disability. Very, very expensive. And then I just thought, so am I going to be looking at this girl like this? And just, is there nothing I can do? And like she also mentioned in Lagos, she said, it's not just the child being sick, it's the management of the child you have with disability. How well can you make this child happy? How well can you make this child, independent, no matter how, even if it's just music. Like I intend to start music therapy for my kids in the center. So even if it's just the piano they can play, even if it's the guitar, whatever it is, to just let the child have an appreciable life. That is just what I'm after. Like, I'm very passionate about it. I've sent out letters to companies, individuals, the government. When you're yet to get support from them, this I have done single-handedly with my husband. I have my husband to thank for all this anyway. And so we are hoping maybe from this interview today, somebody will somewhere will hear us and the government will like, okay, fine. How can we come in to help you at the center? The center is there, the children we're managing is there. It's a broad spectrum for me. I have all of them, as in all cases of disability. And for now, I intend to keep it that way and see how far we can go. And hopefully, we also think with more support, I think we have a very good management of the kids at the center.
All right. Just to indicate to our viewers, we have a number of tweets that have come in. Now, all the tweets are asking questions that our guests have already answered in the studios. They're also talking about the need for support for children with special needs. It turns out clear that our focus has turned out to be more on cerebral palsy and less on autism. If you were to ask me now what is the difference between the two, I'm unable to immediately decipher. It's possible that we just might have to return to that. But before we sign off our guests, cost has been referred to. Physiotherapy, how costly might it be? Very, very quickly.
Well, physiotherapy is not as cheap because there are a lot of things involved. One time, for a patient like this, you need a lot of time. Even though you have empathy, you have patience, but your time is also important to you.
Cost per session.
Yes, and you need to invest a lot of time into this patient. So that's why maybe sometimes they might say it's expensive. I don't know.
Cost per session.
Yes, I'm talking of cost. The timing determines the cost. Now, this patient is not like a regular patient whereby you can handle in 1 hour. You might spend 2 hours, 3 hours on this patient each day.
How much is that?
Well, in the government-owned hospitals, it might be 1,500, might be 2,000 per session. And the private sector is a bit different, because they're not getting salaries from government and they still need to pay their bills.
How many sessions do you need in a week?
It depends. It can have everyday session. It can also have 3 times in a week.
All right. At this point, we just have to appreciate. We have a second topic, but we want to appreciate all those who have sent your tweets and all your questions. I do hope that the doctor here has been able to answer some of them. But as Kingsley said, we might be returning to this topic later on or sometime in the course of our production. Let me quickly appreciate. Let me start with Ijoma Obiajonwa Ajama, a private physiotherapist with Alliance Hospital here in Abuja. Thank you, Ijoma, for joining us. Lola Aneke, Lola, thank you very much. Let me thank Dr. Francis Mbanefo, who had to cut short his trip to be with us today. Thank you very much, Dr. Mbanefo. And from our Kano studio, let me appreciate Aisha Bose Funsho. Aisha, thank you very much. And from Lagos, Nonye Nweke. Nonye, many thanks to you for coming. And that's it for this topic. We'll take a short break. When we come back, we'll be looking at how a private hospital in Abuja is trying to reverse medical terrorism. Join us again.